This is Applied Pharmacology, Chapter 14. In this chapter, we talk about anti-inflammatories and pain relief. There are certain key terms that are part of this chapter. They include Addison's disease, analgesia, Cushing's disease, deep pain, histamine, iatrogenic, modulation, nerve block, prostaglandin, regional anesthesia, transdermal application, and transduction. So there are a lot of different things that you should remember from previous lectures. So what is inflammation? This is a protective response elicited by injury or tissue damage. This is actually intended to protect our body and to heal our body. Sometimes inflammation gets out of hand. It can be caused by physical, chemical, or biologic trauma. It's characterized by heat, redness, pain, swelling, and loss of function. I have a picture here of a cat, the back of a cat's mouth. So this is stomatitis caused by influx of lymphocytic cells, plasmacytic cells, and eosinophilic cells. So if there's too many of these white cells in this area, it is going to cause problems. The process is complex. There's the dilation of arterioles, capillaries, and venules, so everything dilates, which increases the permeability of blood vessels and increases blood flow to the area. Once we have the increased blood flow, we start to see this activation of smooth muscle cells. Well, we get the vasodilation. We have the activation of the endothelial cells, which upregulates adhesion molecules, breaks down the tight junction. We get exocytosis of certain bodies, inflammatory mediator production secretion. We get extravasation of leukocytes, so they come out into the tissue. We see neutrophils, and some other cells, all the white cells that we expect. Leakage of plasma proteins like IgG and complement. We get a mediator release, systemic spread of mast cell mediators. So a lot of different things happening at this time. So here's what increases: migration of white cells into the inflamed area, or neutrophils, starting with neutrophils, okay? Any of these granulocytes. We start to get phagocytosis. So each of these are responsible for phagocytosis. Also mononuclear cells, or macrophages. So we get the phagocytosis. We also have increased permeability of blood vessels, which allows exudation of fluids. So fluids are coming out of the blood vessels as well. Plasma proteins and leukocytes are going to enter into this inflammatory process. Our goal is to promote healing with our immune system, our immune response. So acutely this means sudden onset. Classic signs of inflammation have occurred, and this would be a paper cut. Okay, so that's a real, like just a quick wound. Okay, with chronic, we're going to see more of a slow progression, maybe a continuation of an acute form, or a prolonged low-grade form that we actually never see those classic signs of inflammation. Chronic inflammation pathways. Tissue trauma causes a release of phospholipase, which leads to the breakdown of phospholipids. Erases phospholipids. It breaks down phospholipids from the cell membranes to form arachidonic acid. Arachidonic acid reacts with enzymes to produce inflammatory mediators. Arachidonic acid is an essential amino acid. Do you remember the species that it's an essential amino acid in? Cats. Okay, so they have to have that. Then we got histamine, so phospholipase producing arachidonic acid. Histamine release it's released by what? Mast cells, right? When they come in contact with that extracellular fluid involved with the tissue trauma. It causes mucous membrane irritation, contraction of smooth muscle, so we'll get bronchial contraction, increased gastric contraction, increased heart rate. It's going to cause this increased gastric contraction might be vomiting, diarrhea. Bronchial, we might get difficulty breathing, increased heart rate. Dilation of capillaries, which increases blood vessel permeability, so we'll have an increase in flooding of the tissues and decreasing blood pressure. Some adverse effects, if we have an overreaction of the inflammatory response, would be an allergic reaction, autoimmune disease, or immune-mediated processes. Here is a dog having a erythematous reaction. Okay, see all this redness? Okay, it's reacting probably to penicillin or something like that, and its skin is just flaring up. We're having an immediate inflammatory response. That's an overreaction. What else do we need to know about the inflammatory system? Prostaglandins are mediators of inflammation. They aid in maintaining the blood supply to the kidney, so they're good for the kidney. They can cause an asthma attack in asthmatic people who come into contact with them. So if you're giving prostaglandins like PGF2 alpha, which is also known as Lutalice. You remember that in reproduction? Okay, so Lutalice, we give PGF2 alpha. If you're asthmatic, you're going to have a reaction. Prostaglandins are also very important in maintaining the health of the GI tract. They decrease pepsin. They stimulate the secretion of sodium bicarb, so that neutralizes stomach acid contents before they enter the intestine. And they increase gastric pH. And so all of these things we're trying to do. So increasing gastric pH, meaning they're making it more alkaline with that sodium bicarbonate. So all of these things help with the health of the GI tract. So if we're stopping the prostaglandins, then those things, those protective mechanisms go away. Pain can be a response to inflammation. Remember, pain can be okay. Certain nerves are stimulated, causing neuropathic pain, burning, tingling sensation, or it's as a result of inflammation, irritating those nerves. It can be localized, caused by stimulation of specialized nerve endings, or it can be generalized. It also involves perception. Okay, so who's a big baby? All right, so who's going to have, okay, that would hurt. I would probably react in the same way. But some people would take that and go, oh, huh, that felt funny, or start laughing at it. Okay, so it really involves perception. So who's a big baby? We see beagles, we're automatically thinking that they are going to respond more than, say, a Labrador retriever. So that has to do with perception of pain. All right, what are our clinical signs? The animal's going to be trying to escape or get away from the stimuli. They may vocalize, have an increased heart and respiratory rate, and that may be the only thing you see. We might see pacing. We might see aggression. We might see sleeplessness or wakefulness, self-trauma, weight loss, and anorexia. So what do we need to do? We need to do some pain relieving or anti-inflammatory drugs. A pain reliever without anti-inflammation would be something like Tylenol. Tylenol is simply a pain reliever. It does not have anti-inflammatory properties. Things that do help with inflammation would be NSAIDs, non-steroidal anti-inflammatories. Steroids are steroids. They do even better with inflammation. Opioids, antihistamines, and muscle relaxers are all helpful with pain relief. Starting with NSAIDs. These decrease inflammation without the use of steroids, so they have less side effects than steroids will. They promote analgesia and also fever reduction. So they're antipyrexic. So they're like Ibuprofen or Advil. That's a non-steroidal anti-inflammatory. The mechanism of action for non-steroidal anti-inflammatories is by inhibiting cyclooxygenase activity. What is cyclooxygenase activity? It also can inhibit some lipoxygenase activity. So what happens? Arachidonic acid, remember that's produced by phospholipase breaking down cells. So that's produced in the inflammatory process. When arachidonic acid is formed, it combines with either lipoxygenase or cyclooxygenase to make leukotrienes and other inflammatory mediators or prostaglandins produce inflammation. So if we can stop this from happening by blocking cyclooxygenase or lipooxygenase, we're not going to get to the point where we're getting inflammation. Clinical activity, some species are more tolerant than others. Horses are more tolerant to NSAIDs than dogs. Dogs are more tolerant to NSAIDs, way more tolerant than cats. These are highly bound to albumin. What is albumin? It's a protein. Okay, so they're highly protein bound, which means they cross into cells easily. Okay, if we have low protein levels, low albumin levels, this will mean that we have increased circulating NSAIDs, and that will increase the toxicity. So low protein means increased toxicity. The major side effect that we'll see with NSAIDs is GI distress, vomiting, diarrhea, anorexia, and reduced platelet aggregation, so bleeding. Gastric ulcers, because of the inhibition of prostaglandins, we'll see a decrease in pH, so it become more acidic, decreased turnover of and repair of the GI epithelium, and a decrease in sodium bicarbonate, which should be there to buffer the hydrochloride. Okay. Some family members of these nonsteroidal anti-inflammatories. The first one we're going to talk about is bute. It is commonly used in horses. We give it Peros by mouth, orally, or IV. It relieves musculoskeletal inflammation. Musculoskeletal meaning the muscles or the skeleton, the bones or the muscles, okay? It's metabolized in the liver. We can get tissue necrosis if we inject it sub-Q or IM, so we give it IV or PO. Do not use in cats, okay, because they're very susceptible to it. Some others, aspirin, also known as acetylsalicylic acid. I had to practice to say that. You might want to practice that too. It's fairly safe in most species except in cats. Oh my gosh, this is a theme. We want to use with caution. We can give a half a tablet every 3 days. 3 days if we need to. Half-life in dogs is 8 hours. Half-life in cats is 30 hours. That's a long time. It's because of their glucuronic acid metabolism. They don't have it in their liver, so they cannot make arachidonic acid. So it messes that whole thing up. It's very useful in decreasing platelet aggregation, so it can be useful in heartworm in dogs, but it can cause blood vessel disease and blood cats, or we use it with blood vessel disease and with blood cats, and we use it to prevent blood clots in cats with hyperthyroidism or some other disease that causes stasis of the blood flow. Another example would be Flinxin meglumine. This is known as Banamine. We use this for horses for soft tissue or visceral pain, so for colic, right? Other uses, we can use it for disc disease. It is something that binds toxins as well. So we use it for endotoxic shock. Calf diarrhea, parvovirus, so we can use it for puppies with parvovirus, and heat stroke when we get toxins. Ophthalmic conditions, and then post-surgical pain as an analgesia in dogs. Dimethylsulfoxide, or DMSO, is a very smelly, smells like garlic. We can also infuse this IV. If we use it, wear gloves, because it causes cancer. Okay? After redness, if we see redness, pruritus, itching, or edema, that's due to application of the DMSO. Dimethylsulfoxide is really good at going through the skin as a transdermal agent. So it will take anything that's with it on the skin through into the body. So we want to make sure that's put on clean skin. And if we put medication into it, that will increase the ability for it to get into the body. Ibuprofen or Advil is a family member we don't typically use in animals. Naproxen or leave, again, we don't typically use it in animals. Ketoprofen or ketaphin, we use in animals, but it is more dangerous. It's effective, but it's hepatotoxic and nephrotoxic, so we have to be careful with it. All of these can reduce pain, inflammation, and lameness, but we don't usually give it in animals. What is carprofen? This is another family member that is commonly used. Carprofen is Rimadyl, used for osteoarthritis pain. It actually is helpful for the joints. It helps to rebuild cartilage in the joints. So it is good for not only stopping the pain, but also for rebuilding cartilage. Aspirin, on the other hand, will break down cartilage. So we need to remember those two little specifics about those two things. We want to check our liver values before giving because it is highly metabolized in the liver and can cause liver damage. Some other things we use in the practice: Meloxicam or Meloxicam. It's safer for cats, so we'll use it more often with cats, but it is limited to one-time use typically. Daramax or Daracoxib is for pain and inflammation associated with osteoarthritis in dogs. Onsior is Robenacoxib, which is used to control pain associated with surgical procedures, arthritis, and other causes. We can do once-a-day dosing, and it can be used for cats 3 days post-surgery, so we can use it for longer-term pain relief in cats. This is a PS gag. We're going to talk about this as a miscellaneous drug as well. It does help with reducing prostaglandins following a joint injury. It also is a building block for cartilage, and so this is something that it does inhibit enzymes for the inflammatory pathways, but we're often giving this as something that will help to rebuild the cartilage in the joint. It is given for canine, it's given as an IM injection. So I do have a summary chart for you with the different categories of medications, how it's available, what the uses are, and who we use it in. So I would definitely recommend that you take and print this page or use this to create your flashcards. Pain relief, this does not involve inflammatory pathway. It has nothing to do with inflammation. It is analgesic and antipyretic. It is fatal to cats. Dogs can develop toxic liver changes like jaundice and which we can see jaundice and weight loss with it. And so we have to use it with caution in dogs. I often don't even say that we use it because I'll be honest, if I send my husband to the store to get Tylenol, there's just as much a chance that he's going to come back with ibuprofen as Tylenol. People don't see the difference between those two things, okay? It is not ibuprofen. It is acetaminophen. Different, okay? Opioid agonists. These are used to control moderate to severe pain in animals. Now, we've talked about these drugs before, so I'll go over them as far as how they work for pain relief. Morphine, new morphine or oxymorphone, Demerol, very highly effective. Codeine, fentanyl transdermal or Duragesic. This is used on the skin. We can also use fentanyl IV through a constant rate infection. Fentanyl has a very short duration of action, so it is not used often. And then tramadol is a synthetic opioid. The effects are respiratory depression, sedation, and excitement, especially in horses and cats. Cats are more sensitive to the excitatory effects than our other species, so they tolerate low doses really well. Transdermal fentanyl, we do have to be careful, wear gloves. We don't want to lick the patch. Don't want to touch the patch. We want to put it over the dorsum of the neck, clip it, clean it, allow it to dry well, and then get some good skin contact and then bandage it over top. Okay, we don't want to let children touch it, allow the dog to lick it. Oftentimes we will hospitalize the pet when we give them transdermal fentanyl because of the propensity for misuse in the home. Some partial agonists and antagonists include butorphanol, bentazocine, and nalbuphine. These are effective for mild to moderate pain and have few side effects, and they can also be used as an antagonist in some cases. Buprenorphine is a partial agonist-antagonist as well. It is the primary drug in this category. It's more effective as a pain relief, especially for cats, sublingually or buccal. We don't want them to swallow it. and also has some use for mild to moderate pain in dogs and horses. We'll often use this as a part of the pre-med or butorphanol or buprenorphine or one of the morphine derivatives. It provides pain relief as well as sedation. Antihistamines can be used as pain relief too. They prevent histamine from combining with tissue receptors. So they are best used as a preventive because they prevent binding of the histamine, but they do not prevent histamine release like steroids do. These come as injectables, oral preparations, and topical agents. They inhibit the effects or spread of the inflammatory process, so they're competitive antagonists to histamine receptors. If I have somebody call me and they say, my dog is limping, it's late at night, I don't want to go to the emergency room. I've seen their dog before, so I can prescribe medication or suggest medication. I will tell them to at least give a Benadryl at a certain dose because I know that it does have some pain relief effects. Can be used to treat a lot of things. So pruritus, urticaria, and angioedema associated with allergic reactions, laminitis in horses and cattle, Downer cow syndrome when they're down and unable to get up, motion sickness, reverse sneeze syndrome, anaphylactic shock, and respiratory tract conditions, upper respiratory tract conditions. So I love antihistamines. They're fairly safe. Antihistamines are not as effective in controlling pruritus in animals as they are in humans. I do find that chlorpheniramine maleate as an over-the-counter is better for dogs than just about anything else. Diphenhydramine is Benadryl. Cimetidine is Tagamet, and that's most often used for the GI tract. Dramamine is most often used for motion sickness. So a lot of different types of antihistamines. Muscle relaxants can be used as an aid in the treatment of acute inflammatory and traumatic conditions of muscles and spasms that can occur because of that. They work by decreasing muscle hyperactivity without interfering with normal muscle tone. Most don't interfere with normal muscle tone. Some do cause the muscle tone to become more relaxed. So we'll use this in dogs, cats, and horses. Methocarbamol is Robaxin. If they have intervertebral disc syndrome, so a slip disc will cause those muscles to contract because it tries to stabilize the spine, and so it will cause some pretty good cramping of those back muscles. You can use it for strains, sprains, myositis and bursitis, muscle spasm, and then the condition called tying up in horses when they're over-exercised and have an imbalance of electrolytes, causing the Charlie horses or the cramping of the muscles. Some side effects, these are generally sludge side effects, so excessive salivation, vomiting, muscle weakness, diarrhea, ataxia when they're overdosed. Corticosteroids are used to treat inflammatory, pruritic, and immune-mediated diseases. There are drugs that are also at different doses are used to treat shock, laminitis, anorexia, because they promote polyphagia, adrenal insufficiency, which is what? Addison's disease, right? Hypoadrenocorticism, and various other conditions. We have to remember that anytime we're using a corticosteroid, we're only treating the symptom of the disease. The only caveat to that is when we're supplementing corticosteroids with adrenal insufficiency. So how do the corticosteroids work? So stress can cause corticosteroid release from the adrenal gland, from the cortex of the adrenal gland. This is the adrenal gland, sorry, that's the kidney. ACTH stimulating, or ACTH, or adrenocorticotropic hormone, stimulates the adrenal cortex to release corticosteroids. Okay, and these corticosteroids will then go to the target organ. They're useful in treatment of the following conditions: allergic reactions and conditions, inflammatory conditions, the musculoskeletal system, shock, toxemia, laminitis, inflammatory ocular conditions such as conjunctivitis, uveitis, Addison's disease, autoimmune disease such as autoimmune hemolytic anemia, lupus, and rheumatoid arthritis, and lymphocytic neoplasms. This is a lot of conditions. Now we have to remember that corticosteroids, glucocorticoids, are useful all around the body, and that's why it's helpful. Okay, but it doesn't just have one effect when you give it. So it's going to affect everything in the body, which is why we see lots of side effects. We can give corticosteroids by injection. They're in injectable, oral, topical forms in preparations that contain also antibiotics, antifungal, and corticosteroid that combine that with corticosteroid products. Prednisone, prednisolone, dexamethasone, soludetyl Cortef, and Depomedrol. These are all dosage forms that we use as corticosteroids. Some are longer acting, some are shorter acting. So soludetyl Cortef, very short acting, Depomedrol, very long acting, can be months or weeks. These products can be applied to the skin or mucous membranes, injected into lesions, given orally or administered parenterally, so they're all over the body. A lot of times we want to give like lower doses and do alternate day dosing and then taper off gradually. If we don't do this, we can cause iatrogenic hyperadrenocorticism. Iatrogenic means I did it. I caused hyperadrenocorticism, which is Cushing's disease. We never want to stop this suddenly. We never want to give large doses over a long period of time because we can cause the body to create an issue with having to make more corticosteroids. We can use very large doses in an emergency situation. We're not going to use it over long terms. We're not going to use it for the treatment of corneal ulcers because that can delay healing of those ulcers. And if we're giving it into joint spaces, we have to be very, 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 very careful that we are using aseptic technique. If we take bacteria into that joint space with a corticosteroid, we're going to create a joint issue, an infection. So, what are our pain-relieving anti-inflammatory drugs? NSAIDs, opioids, antihistamines, muscle relaxers, and steroids. Categorize those drugs. Make sure you understand how they work, who we use them for, and that is going to help you understand how to create analgesia in your favorite pet.